Good morning, everyone, and welcome to our online shared learning event titled Fundraising for Health in Challenging Times. And this event is organized by Global Health Partnership Cymru and hosted by Hub Cymru Africa. Thank you so much for joining us today. Today, Wednesday, 11th February 2026. Um, Next slide. Before we begin, I will quickly run through a few housekeeping, especially for those who may be new to Zoom. First, could you rename yourself to include your name and organization, as this really helped during discussion time. And just to let you know, today's section is being recorded. This is so for colleagues who are unable to join us live can watch later. And by staying in this section, you are giving your consent to be recorded. We'll also be sharing the slides and any useful resources after the event. In terms of viewing, you are welcome to use gallery view or speaker view depending on your preference. Please keep your microphone muted unless speaking to reduce background noise. We really encourage participation, and you can use the chat functions to share comments and questions at any time. You can also raise your hand, though please note that speakers may not always see this. Our team are available to help us flag questions, and we will pause at the key moment to take them. And if you have any concern, any experience technical issues such as poor internet connection, try turning off your camera. And if you drop off, please rejoin using the same Zoom link. We value everyone's contribution today, but to help us to keep to time, we ask your permission to gently interrupt if needed. We also want this to be a safe and respectful space. Constructive discussion is welcome, but lived experience are not up for debate, and no form of abuse will be tolerated. If you have any safeguarding or whistleblowing concern, information is available on SSAP website, or you can send a mail to Julian Rosa at at upcamru.wales. To agenda, please. Today's agenda include welcome and introduction, speaker presentations, and a panel discussion. And there will be a closing remarks. And with this, I'm now delighted to introduce our chair for today's event. Her name is Isra. Is an advanced epidemiologist scientist at Public Health Wales and chair of Global Health Partnership Cymru, with over 8 years experience across epidemiology, pharmacy, and public health in Sudan and the UK. With that, I'm pleased to invite Isra to take the floor. Thank you.
Thank you so much, Simeon. Borida, Christo, Kenneth. Good morning, everyone, and a warm welcome to our shared learning event on fundraising for health in challenging times. Just a bit of a review about Global Health Partnerships Cymru. We bring together organizations and individuals across Wales who are committed and interested in improving health through international collaborations. We work closely with charities, health institutions, organizations, diaspora groups, supporting partner links in Wales and low and middle income countries. I would like to thank Hub Cymru Africa for supporting and hosting this shared learning event, and the Welsh Government for their funding and continuous support. At our annual lecture last week, we talked about crisis in global health aid cuts, and in the light of this difficult situation, this session aims to provide some practical and potential alternative routes for funding. We will hear from Angela Gorman, the CEO of Life for African Mothers, and we'll hear also from Tabel Lipene, founder of Starlight Oasis of Hope Hospice. It's now my absolute pleasure to introduce Tabello, who will focus on engaging donors and demonstrating impact for fundraising. The floor is yours, Tabello.
Thank you very much for the invitation to be part of this event. As I introduce our slides with Dr. Paul Myers, if he's able to pass some remarks and comments, just know that we are in this together. So we are Starlight Oasis of Hope Hospice. Next slide, please. And through the collaborations across the two kingdoms, in the United Kingdom as well as the Kingdom of Lesotho, we have got the registration within the England and Wales Charity Commission, as well as a non-profit here in Lesotho. And we are grateful for the great support that we have had through the Dolan Cymru community in making our efforts get started. Next slide, please. The pain points here in Lesotho, as I am in Lesotho at the moment, it is mostly around the communicable diseases, of which cancer and the long-term impacts of diabetes and hypertension and disabilities and others have really impacted the lives of individuals and families. And we also have the very high prevalence of HIV/AIDS disease. Next slide. Being a registered nurse who lived and worked in UK over 2 decades, what brought the vision and burden was to see how the people here at home were suffering with the care gaps that existed, and hence I started really meeting people with like-mindedness in trying to bridge issues that affect other humanities in other parts of the world, and hence the birth of Starlight Oasis of Hope Hospice. And I'm grateful for all the support over so many years, and Dr. Paul being the pioneering trustee. Next slide, please. Issues have been around the total care, which are mainly, as we know, would be around psychological issues, physical, social, and spiritual dimensions of people facing health-related issues, especially around those life-limiting conditions. And what I noticed here at home in Lesotho was the fact that more of the focus was around the physical issues, the pains and symptoms, but a little around the other dimensions, and hence there was a need to really see how we can support people in those well collaborated and multi-professional approach. Next slide, please. Our operational pillars here at Starlight has been primarily around advocacy for so many years, bringing the awareness and appreciation of the need for palliative and hospice care approach here in Lesotho, as it was and still is a growing new model of care. And therefore, we realized also that for Starlight to duplicate itself across the different health facilities and district hospitals, as we have 10 districts here, it was to ensure that the knowledge is decentralized through capacity building. As a result, we have trained over 100 people on a face-to-face multi-professional trainings with our training partners from UK Palliative Care Works. And also we have done previously, before that in 2023, the online trainings, which also saw more than 120 people that joined and completed the trainings. And we also realized we can only continue to make a lasting impact if we ensure that the beneficiaries of our vision, which is the families and the patients and their families, was also to see that there is care and support through many kind of services that we believe would make a difference, whether it's home-based, daycare services, or even the inpatient facility. and therefore treatment will be provided in different settings. So funding has always been the key that will make our vision sustainable, and hence why it appears on the slide. Next slide, please. We have got a land here in the district of Berea, just now, about 15 kilometers out of the capital city of Maseru. And that is where we believe home visits to those who are not able to come to our day center would be essential. And daycare services here at our facility, hence we now got the facility sponsored by the corporate community. And finally, our long-term impact would be to ensure that we relieve patients and families by offering them the 24/7 care. And we are working with the Ministry of Health collaboratively, as we have got an MOU with them since 2017 to ensure that the guidelines and policies around palliative care provision can be in place, and drafts have been made. We are still yet to work that long journey to make the policy a practical thing. Education and training, as also mentioned, it also includes not only the frontline multi-professional and social care teams, but also the academic world. We have been involved in training the tutors from the 6 health institutions, training nurses, as well as the faculty of health within the National University. And also the main challenge here is the lack of morphine or other pain management, or even essential medications that are usually needed during palliative care challenges for patients. Next slide, please. As I mentioned, that advocacy has been one of our major pillars. We have been doing advocacy in different settings, whether it is within the political environments, within the parliament, but also within the community settings through media, newspapers, and other forms, but also through the support and network of the authority and powers that have got influence in decision makings. And therefore, we still want to honor and appreciate our former British High Commissioner, Mr. Harry MacDonald, who in 2023 really invited the corporate community to the British High Commission just to enable us to have that space where we can explain our vision. That was after that when the corporate banker that has sponsored our phase 1 building really took a serious stance because previously they had pledged many years before, but nothing materialized. Yes, partly due to COVID, but that made a huge difference. Next slide, please. I think the major thing that we saw that supported our funding strategy or approach, we have been in this action learning process in the Starlight community for quite a long time, whereby we were trialing and seeing how things can work out. And thanks to the experiences of others who were within our team in the trustees board. But we have made sure that we engage the patients and their families, in general, the beneficiaries of our vision, in such a way that everyone, whether it is within the policy-making capacity, the funders, or the patients themselves and the general public, they can appreciate that there's really a clear gap within the care services, whereby the patients with long-term chronic conditions didn't have much support in a holistic way. And that is why then Lesotho Bank made sure that they engage other corporate community and golfers by starting the fundraising appeal for us by holding the golf events in those tournaments since 2022, year on year until even this December 2025, they have been raising funds because there's a clear indication that there is a need for more holistic approach into people's conditions, whether it is where people see their own families, they themselves need such care, or their colleagues at work. And therefore, we are grateful for the Byd-eang Cymru and the Welsh government by sponsoring teams that come out to Lesotho, because that is another statement that confirms that there is a shared need for humanity to be given the respectable, dignified, compassionate care. So here with Dr. Annette, we had met the academic institutions in one of the nursing colleges just to share that palliative care needs integration, and that buy-in from the academic world also increased the profile of Starlight and our vision and what we want to achieve, and hence there was more support. Next slide, please. Here is just to say there's always a message of hope we can share with people. What can be really seen to be a devastating experience for patients and their loved ones, but also to highlight how can the difference be made. As Starlight, through this fundraising by Lesotho Bank, it helped us to continue also advocating and raising awareness that despite the prognosis, despite the unpredictable conditions that people might be experiencing within the serious health-related conditions, but there is still hope that we can support them by minimizing the distress, the unnecessary pain and suffering, by providing care and support. And hence, there was this sword-turning event in 2023. And we saw the building that is now complete, our phase 1, as I mentioned earlier, and the fundraising has begun into the phase 2, which will provide more services. Next slide, please. These are just snapshots of our building. As you can see and appreciate, there's still a lot that might be needed around the sideworks, paving, and you can see the retaining wall being built. But we are hopeful, and we remain hopeful, that with us showing the impact, showing the benefits to the wider public and corporate world, that will help us to attract the support, because there will be an impact that is long-term and lasting for many. So next slide, please. Why invisible currencies? It is just to say, if we have now educated, raised awareness, and shown the need and the impact that can really reshape many patients and families' quality of life on a day-to-day basis by simply getting the support and really having their needs being addressed, how are others taking it? They get into the buy-in and they share what we are trying to do in a way that they contribute to whatever they have. They might not have the physical money, but then the services they provide within whatever businesses they are operating, they have been trying to contribute. Here was one of the companies that manufactures the office equipment and what have you. They might not have for that finances to pull out of their account, but then we were very much flexible with what we ask, not necessarily to look into the cash that will reflect in our bank balance, but the services they support us with is already an invisible currency that addresses and closes the needs within our service, so we can be able to now reach families and patients. The other picture is where the Ministry of Water Affairs, having committed their support since 2020, have finally done the borehole for us in this last week. And we are now knowing that we are not going to have issues with water once the systems are connected. Because we are in the outskirts of Maseru, the main water supply has not reached our area, but we can depend on the underground, but at least they have been really buying into our vision to try and minimize the distress for the nation and hence the support. The next slide, please. I think here it was just to show that there is not any single journey without challenges. We have been really experiencing a lot of setbacks, unpredictables, delays, and frustration and disappointment throughout our mission. However, because we have always held hope, knowing that if we give up on our efforts, that is to let so many patients and families, of which we didn't feel comfortable, that it will be the right thing to do. And having that the end user in mind has really kept our energy, our courage, our efforts, even to think outside the box of what might work. As I mentioned, we have been in this action learning process just to trial new things all the time during these difficult circumstances, whereby many businesses have had problems since COVID, and some of them have not recovered. We had to really try and think, outside the box. Next slide, please. Can you let me know how many minutes, please, left? Okay. Next slide, please. We have been trying to reflect and see how and what might have helped our journey. We haven't completed the process yet because we've been so focused in the action to make things happen and make our physical presence practical. But as we have seen what has helped our fundraising and strategies to campaign for support, it has been clearly to stay on the same message, be consistent with the message of impact in who is going to be the beneficiaries of our services. How is that going to help with the politicians and policymakers? How is that going to be financially beneficial for the nation's health budget? So that has been our message throughout. And also to our sponsors, how can we really make the trust and maintain it? Because trust is cumulative. It's not just one element that makes it, but the couple of those elements, they make things possible for the funder to see that you are credible through transparent reporting, making sure the data is aligned and consistent, also to capitalize on invisible currencies of really appreciating the relationships, the open doors that we are given. Just an example of our British High Commissioner and others around the world that have been connecting us to other organizations, probably supporting us with education and training, not necessarily giving us money, but giving us their time, their experience and knowledge to make an impact here and attract more support as we continue our journey. But again, it is a human thing, heart-to-heart, mutual appreciation of the need. How can we be compassionate about making a difference and giving service to those that are less vulnerable than us, lesser fortunate than us, and being persistent and resilient even in the sight of so many setbacks. We kept on going, disappointments within decision makers and everything else around our efforts. But at the end of the day, to remain humble, to learn anything we can from the experiences we have, knowing that challenges or a crisis in a journey does not always mean danger. It also means an opportunity for something to be seen from a different perspective, and try to find how can we fundraise, how can we negotiate discounts from where we buy the material for the building. All those things, and really honor those that have been taking part, sacrificing their time and efforts, really giving us the platform of their offices and integrity and reputation. to really acknowledge them. Our patron is Her Majesty Queen of this kingdom. At the end of the day, we have got the patron as well in the UK, Baroness Finlay. All those personalities, we don't take them for granted. We give them honor and also appreciate their support in taking us on board as the people they can look after. Teachable spirit, as I mentioned, as we reflect and see the trials and challenges, how can we learn from that? Be open-minded about learning new skills and learning new opportunities. The storytelling from the patients, from their families, and even the decision makers around the boardrooms where we meet them as we appeal and raise awareness about the need to close these care gaps. How is the storytelling play? It's not just a story, it's about the human life impacted, which can be made better by a little efforts. So everyone wants to build and really show legacy in trying to do something contributing to the humanity in a positive way, and hence more people become aware of what we are trying to do. Next slide, please. I think it's all about saying the fundraising in these difficult times. It's all about the mutual shared feeling about what is to be done about those funds, to collaborate and build a trust, and also make sure that there is a team that monitors performance. We agree on what will make the impact, and therefore we want to work with the many across the world to support us as we make impact. And also we believe our little story from the Kingdom of Lesotho, making the efforts to make a difference in the lives of others, will somehow maybe have a little bit of a wisdom that others might really see as something they can trial. It's not something that we say is perfect. It's not something we say it didn't have 4 challenges, but it is the journey that has been unique to our vision. If you want to walk fast, to go alone, but then if you want to go far, we go together. And hence we need the partnership of not only the ministry, the other stakeholders, but even the corporate world and the sponsors across the globe. The next slide, please. It always seems impossible until it is done. And all that we are trying to do is to ensure that our purpose to make a difference on the lives of others, it is embedded in the matter that we know within communities, there are families, within families, there are individuals. And if one of them is not in a good state of health or mind, therefore all others feel the same. Therefore, we are trying our best to do all the good we can, by all the means we can, in all the ways we can, despite the challenging funds that are limited, but in all the places we can, at all the times we can, to all the people we can, as long as ever we can. The next slide, I think it's done, isn't it? Thank you very much. This is our presentation, and if Dr. Paul is able, maybe he can say a few words, if only we still within our time. Thank you.
Thank you. We're good with time, I think. If Paul is available and would like to give some reflections, that should be great.
Yeah, I'm here. Hello.
Hello, Paul.
Hi, everybody. Byd-eang, my name is Paul Myers. I'm chair of Starlight. You'll have to forgive me. I had a general anaesthetic last evening, and I'm fine, and it wasn't anything serious, but I don't feel entirely with it. So if I start becoming incoherent, you can either shut me back or take it as 3 minutes entertainment. So thanks, Metabello, for that, and just some thoughts that I've been jotting down in terms of what do we need to do to get fundraising. We actually haven't got much financial support from in the UK. We've got a few generous supporters, which are largely people that we know, friends. We don't have a large supporters network. And we have a few people who give regular donations, like £10 or £5 a month, and every little bit's valued, of course. We also have had some help by having a partnership or a link with the Wrexham Nightingale Hospice, and they've given us access to their fundraising ideas. So that's also been hugely helpful for now and the future. And a partnership with Palliative Care Works, which is a training organisation in the UK that Tabella mentioned, and they've given of their time for nothing in coming out and helping us with our training, although we have had to raise the money for their airfares. And of course, that's one of the big issues that when you work across two countries, that you want to keep traveling to a minimum, but there's certain things that do require face-to-face activities, and the cost of getting people there is not significant. So I think what makes us successful is, I think contacts are incredibly important, and getting to know people with influence, not necessarily with money, but people with influence. And the British High Commissioner, Mr. Harry MacDonald, who's now moved on, was hugely helpful in getting us into contact with corporates. I mean, I think we probably wouldn't have done it without him setting up a social event with the sort of people that, you know, we wouldn't normally meet and mix with chief executives and others, and took us way out of our comfort zone speaking to these individuals. But nevertheless, how have we won over the corporates? I think it's with a strong sense of passion, and Tabello, as you can see, has oodles of it. Reaching out to their humanity, showing that what we're doing could affect their loved ones, and the importance of looking after each other. So I think trying to reach into that core within them, a little bit separate from their business sense, telling lots of stories, patient and carer stories. They're not our own stories, they're stories that we've heard from people as we've travelled around Lesotho talking to people, heartrending stories, as well as successful stories, and you need both. We have to have a strong business case. They don't want bullshit, if you excuse my language. They want to know that we are capable of delivering. So if we can't come up with a good business sense, we know how much it's going to cost. This is what we need. That's what they like to hear. They like to know exactly where their money is going to go. And also stress the advantage to them. It's good publicity for them. They're seen as a caring organisation. They seem to be reaching out into the community, and also supporting them. Well, we'll look after your employees, and that could possibly help your productivity. Credibility is really important, having the right people on the team, having those right contacts. And we feel in terms of getting money in the future, we've got to start delivering. We can't just keep promising. And it's been a long journey, as Tabello's described, over 5, 6, 7, 8 years. We've got to show that we're delivering care. So we want to get our nurses out there into the community as soon as possible. Even if it start off with we're a team of 3, we actually show we need business. There are so many organizations who go in there shouting they're going to do wonderful things, and they've disappeared in 2 or 3 years' time. We're showing that we're persistent. So be prepared to take risks, which we did. When we started building, we thought, we haven't got the money to finish this. Let's get on with it. If we don't start showing that we're doing something, we took that risks. Most risks have paid off, some haven't. And that's the nature of risk management. But if you just sit back and say, we'll have to wait till everything's secure, you're probably going to take a long time getting going. Be flexible. We actually changed our whole approach when we were, if given this money or pledged this money by the bank, they said, you've got to build. We don't want to help you running a service. We're not going to pay your salary. You need to build. We wanted to get out there into the community delivering care. That has to wait. The money was for the building. We couldn't turn that opportunity down. So we spent a lot of time. We've been distracted by the building. And be grateful for everybody, whatever they do, whether they give their time, whether they give a piece of furniture, whether it's a kettle or a cooker, whether it's £5 or £5,000. Be grateful, continually keep on telling how you're grateful, and keep on telling them what you're doing, because if they see the difference their money make. We got all our corporates to come look at our building, and they were wowed by it, just as we're wowed by it. And that actually, I think, helped to get more money at the last fundraising done by the bank in December. So thanks for giving me the opportunity, just adding that in.
Wonderful. Thank you. Thank you so much, Paul. Thank you, Tabitha and Paul. What an inspirational talk and full of hope. Thank you both. And now I will hand over to Angela. Angela will focus on the sustainable financing and resource mobilization in the health sector. Over to you, Angela. I think you're on mute, Angela.
Apologies. Thank you so much for asking me to present, and good morning, everybody. My presentation isn't going to be quite what you probably were expecting because, well, anyway, just to give you some background, I'm a neonatal intensive care nurse, retired. I started Life for African Mothers in 2005 after seeing a TV programme. And essentially, our core activities have been providing life-saving medications for mothers who are suffering from life-threatening conditions that would be dealt with relatively easily in this country and in the West, and also providing opportunities for midwives to travel and do training. We've worked previously in Chad, Sierra Leone, Liberia, Somaliland, Eastern Congo, and Bamenda region of Cameroon. But unfortunately, we couldn't get the medications to any of the countries that didn't have an in-country representative. So it confined us then initially to Liberia and Sierra Leone. And we've been working in Sierra Leone since 2009. So that's my background. Could you, the next slide, please? Well, that's my credibility, I guess, you know, my background, contacts, and we have had a really great record until now, so much so that in 2020 I was awarded an MBE for the work that we've done. But it doesn't really mean anything to me on a personal level, not a great deal anyway, but when potential donors see those 3 little letters after your name, it does help. And people pick up on that. So that's my personal credibility. I have run this voluntarily for the last 21 years. I've had some help from the board and a previous clinical colleague who retired early. So the 2 of us have been running this voluntarily forever, really. So that's my sort of credibility. Get the next slide, please. Now, because our work is related to childbirth, there's a lot of ethical dilemmas involved. It's not sinking a well, it's not building a building, and they're as necessary as they are. We have come up against some real ethical dilemmas and well, some real problems, really. Things like pressure on women to continue having babies until they have boys, putting their lives at risk, all sorts of things, FGM. And so we've engaged with local communities without upsetting them on these issues. But fundraising has been a real major challenge because a lot of funders will not fund the purchase and shipping of medications to our countries. They'll do other things. They'll fundraise. They'll fund other issues, other challenges, and other activities, but they won't fund the medications, which is really a problem because it's quite expensive to purchase and ship, and we always air freight everything into the countries. So that's been our major problem, and it's been a contributing factor to a decision that we've had to take recently. But I'll come back to that. Could I, the next? In the past, we've tried to complete our own funding applications. And then last year, we decided to invest in paying a consultant to write bids. And 6 were written by a professional, and we received 1, which funded, strangely, the purchase of a shipment of medication to go out to Sierra Leone, 200,000 tablets to treat or prevent postpartum hemorrhage, which would cover about 60,000 women, and also a visit by midwives and one of our trustees in November just gone. So that was unusual that they did, but in the main, they do not fund the medication. So that's down to us to raise, which I did, driving around here, there and everywhere, the 25, 30 pounds. And the cost of saving a mother's life is about £1 with the medications and the distribution costs at the other end. And that was a selling point, really, for most people. It used to be the cost of a first-class stamp, but the stamp out has beaten that now. The first-class stamp is £1.70 here. So it's £1 to save a mother's life. And so that it paid off in the sense that we got a grant, but really overall it's getting more and more difficult to get funding. Okay, thank you. Right, honouring donor intent, ethical use of funds. I'm going to throw a question out to people now. It's up to you if you want to, but organisations, companies who might offer money. I mean, obviously the obvious one, not to arms and tobacco industry, but other companies that may, there have been problems in the past. Is there any way of finding out whether or not any of our audience would consider accepting money from, say, Nestle? Is there any way of knowing? Okay, we'll mention it later, but I just want to let you know that in 2013 I had an email out of the blue from Nestle, and they were looking for a small but effective maternal health charity, and they wanted to help. Ultimately, they gave us, well, the decision was they would give us £60,000 a year. That one of the senior managers from Nestle came and spoke to our board, included all of their policies, whistleblowing, everything that they had done since the tragedy of the formula milk in Africa in the 60s and 70s. And they spoke to our board about how they had made sure everything was okay. They said that there was no need to tell any of the midwives that they would fund, that they'd been funded by Nestle. They didn't want any logos on anything. They didn't want any indication that the money had come from Nestle. And in fact, I've been to a number of countries in Africa, 13 in total. And I have to say that I have never seen a tin of formula milk anywhere other than in a special care unit, because the mothers have died. I've never seen a bottle. Breastfeeding is first and foremost in every place I've been. In fact, I used to say that we should bring some of the mums over to teach our mums here in the UK about breastfeeding. So Nestle gave us £60,000 a year for 4 years, half to be used on visits by midwives, and it was not to be used for purchasing medication, but the rest basically we could do as we wished with. And so ultimately the board agreed, apart from one member of the board who registered her negative vote, which was fine. So we worked with Nestle for 4 years, and incredibly, the impact was enormous. And of course, Ebola struck West Africa in 2014-15. We couldn't go, but after Ebola ended, we funded 57 visits by midwives to travel to both countries, Liberia, Sierra Leone, at the request of the government. They asked if we would do training, not hands-on clinical. And we had an incredible reception, and the impact was significant. Now, underneath all of this, the dilemma that I had was, do we accept this money? And so I put myself in a position of, if we were to say no, as I ate my Kit Kat, if we were to say no, And I went to Africa and I met a man whose wife had died and baby because we didn't send our midwives who could have saved her life. Could I look him in the eye? Could I justify that? Could I sleep at night? And the answer was no. I would rather put up with a bit of stick, as I call it, from people criticizing me for having done that. And I did do that. I got criticism. But ultimately, I and most of the board felt that we had done exactly the right thing. During Ebola, instead of sending midwives, the fund allowed us to ship things like baby clothes, all sorts of things, air freighted all out to help the families. So I'll leave that dilemma with you, but even now, all that time later, I don't regret having made that decision. And we fed back to them, reported back to them, over-reported in a way, and you don't need to keep running. So no, I'd rather do that. And there are other things that they funded. But then in 2016, we met with them and they were going to double what they gave us. And then unfortunately, the Brexit referendum took place. And after that, they decided that they were not going to continue. And in fact, jobs were lost here in the UK. So, you know, Brexit had more of an impact than anybody could think, really. Okay, can I have the next slide, please? As I said, one board member registered her displeasure with it, but she stayed on the board. And I also wrote to our then patron, who was Baroness Kinnock, to let her know what we were doing. And I didn't hear back from her, which I assumed meant that she wasn't going to. She probably didn't agree, but she remained as our patron. Okay, thank you. Now, I know all of you know about UK or USAID being stopped completely. And I'm not going to mention that man's name, if I can. And of course, UK AID has gone from 0.7 to 0.5 and now 0.3. And whilst we didn't apply to any of these organisations, we realised that the knock-on effect of that was that those organisations that were still funding would have greater pressure put on them because people now couldn't apply to these two, and that it was almost impossible. And we realised that the medications are very, very difficult to fund. They're very sensitive. And so over the period of the year, it's become much more difficult. Little donations have kept us going, standing orders, and going out and doing talks and this sort of thing. But it's been a real problem. Okay, thank you. So unfortunately, we've been working in Sierra Leone, and unfortunately, in the last couple of months, we've also discovered that there are issues in Sierra Leone with, I'm sorry I'm being so negative, but you know, we can't give positive all the time. And we have to be realistic with everybody, and what you start off doing doesn't always end up. And after 21 years, we're having to close the charity. And there are difficulties in Sierra Leone, partly caused by the infiltration of hard drugs into the country. And I've actually written to the president's right-hand man to tell him that we're closing, and adding that this is a contributing factor to why we're closing. And so on the 1st of March, our organisation closes formally, but we've learned lessons. And in Sierra Leone, when we started working there, the maternal mortality ratio was 2,100 per 100,000 live births. I know there are other organisations working on this, but the government has told us that we have contributed significantly to a reduction. It's now just over 350 maternal deaths per 100,000 live births. So it's a fifth of what it was. And so we have to realise that, you know, we have to look at the positive in all of this. And there are women and children alive now who wouldn't have been. So, as I said, I'm sorry to end on a negative, but it's also a positive, because as I said, tens of thousands of women are alive who wouldn't have been. But like I said, as with Nestle, don't dismiss organizations immediately, because they have corporate funds to deal with charities, and I think there are times when we can look carefully and in some detail about what they need, what they want from us, and we can help. They can help. We can work with them, and if in the future I can do anything with anybody who's interested in contacting me, I would still be happy to do that. But I don't know if there are any questions.
Fabulous. Thank you. Thank you so much, Angela. Lots of lessons to learn from your reflections, despite the challenging time that the charity is going through now. Thank you so much for sharing your experience and for thought-provoking talk and discussions. I think now we are moving to the panel discussion, and then we'll also ask everyone to kindly post their questions in the chat, and we'll pick up questions after the panel discussion. I have Tabello here. Still, we'll start with Tabello. I have a question for you, Tabello, regarding the invisible currencies. It's amazing how we can tap into local resources without actually like having the money in the bank, but being able to have some of these resources. How can organization effectively identify these invisible currencies from your reflections?
The invisible currencies will primarily being able to connect with whoever you are trying to sell your vision to, so that they can see an impact in a long term, or for people that will benefit from your efforts. And another thing is just to remain true in negotiating what benefits are they for them. There might be little, like Dr. Paul mentioned, the publicity, because if they support you, then they are seen to be credible organizations who are for people, not just for their money as their customers, but also to improve the quality of life in general for the nation or for communities. So those are the things. So the good communication skills, the negotiation, the networking and building relationships that are founded on trust, on credibility, on really showing that you mean what you say in terms of being consistent with your message. Lesotho Bank has sponsored our Phase 1 building after more than 7 years of continuous, non-broken proposals year on year, January. And now they have started fundraising for our Phase 2, of which they have already successfully been able to raise 1.1 for the Phase 2 in 2024. In 2025, they raised 1.4 million. And they were saying 2025 December is the final year. We are not sure if that is the final year, because they are fully aware the 1.4 million will not be enough for our Envision Phase 2, which is proposed to house almost 20 patients, adults and children included in that unit. So they are still committed. They feel part of the journey. They feel this is the legacy that they have been founding, because not everyone was bold enough to take the courageous step to support us, because they didn't see the urgent or immediate benefits in a general sense. So they were the first ones to be bold to come out and say they are sponsoring our efforts. And now we see the others coming along Toyota have bought us a vehicle which Lesotho Bank has partly sponsored too. We see the corporates that in a wider sense, the network companies providing us with unlimited Wi-Fi, like I'm connected from our building now because we have got a Wi-Fi that is unlimited for the coming 3 years. The insurance for that vehicle covered for the coming 3 years. Another company saying, I'm joining in. When that 3 years runs out, I am coming with my 3 years. So it is all about really letting people realize the need is there, communicate it clearly, continue the message consistently. Thank you.
Fabulous. Definitely. Thank you, Tabelo. And it's quite important, to emphasize on the importance of sustained partnerships and to make sure that everyone included feels that they are part of the journey themselves. Thank you, Tabelo. My next question to Angela will take you back to the Nestle funding application process and the implementation of the program. So it's a difficult time when you have to make some difficult decisions, especially when you have immediate health needs for the population that you're serving. How can you maintain public trust and ethical accountability during these times?
In relation to Nestle, did you say, or generally?
In relation to Nestle.
We were open and honest with everybody with what we were doing. Each time a midwife rang me interested in going, I would ask her name, and then the next statement would be, I need to tell you how you will be funded. And all of the midwives agreed that it's about the women and saving their lives. And only one midwife, because she felt that she had to be governed by the UNICEF guidelines, refused, said I can't. But the irony of all of this is that if you have a mother who dies of postpartum hemorrhage, which is the biggest killer, and her baby survives, how is that baby fed? And I, in hospitals, a couple of hospitals, I went into their special care unit, one particularly in Liberia where there were 2 babies in special care. One, the mother had been knocked over in a road accident and they did a section last minute and got the baby out and saved. The mother died, unfortunately, and the other one mother had severe preeclampsia, was fitting. So they were being fed with formula milk, which the staff had gone out and bought out of their own pockets. So when I came back, I contacted some of the milk companies through my NICU contacts, and they all said, I'm really sorry, we'd love to donate, and we would, but we can't. And it did cross my mind afterwards whether or not the ban had caused more babies to die than the milk did, because babies they need feeding, obviously, and how do the families feed them? I don't know. So that's the sort of thing that I would say that I would put out there. And as I said, I did have issues with a few people, but nothing major. The vast majority saw the mother at the end as being the most important person in all of this, and the baby. And I sent reports to Nestle. They were overjoyed with what we had achieved, but then, as I said, unfortunately that stopped. It would have been brilliant, but don't turn your back on any organization till you've looked carefully at what they're doing, and never say never, because I mean Nestle was a no-no, but it's not anymore. It's just one of those things. But we were totally upfront with everybody in what we were doing with Nestle funding.
Thank you, Angela. It's all about transparency, and I think it's definitely the core in building and maintaining trust with everyone involved. Thank you, Angela. We'll ask everyone to post their questions in the chat. Please feel free to do so. If any one of the panelists would like to raise or continue discussing any point, please feel free to jump in. I have my last question to you, Tabilo, before Angela, and we'll follow up from the trust itself, with following from Angela's reply regarding the trust with the locals, but also with the funders in the UK and globally. How can we build and maintain the trust? You mentioned sharing the data, the strong story telling, and the sustained partnerships. But do you have any additional reflections you would like to add to that based on your work on Lesotho? Thank you.
I think in addition to that, it will be showing the strong leadership in terms of taking responsibility and accountability of the actions, and also making sure that there is that shared and understood the health outcome that we are driving for. So I believe it is what has really helped in our case, so that there is that sustainability in terms of the desire to stand by us and support us, even if it is just by as little as just introducing us to other powerful or influential groups or teams, whereby at least people would understand who we are as people behind the Starlight vision, but also trust us that we are able to deliver through all those combination of factors, whether it is just the credible, transparent reporting, but also maintaining the consistency of such shared information, but also the evidence of the beneficiaries of the care we provide, their statements, their testimonials of the nurses and the doctors or pharmacists that we trained. How is it making an impact in their day-to-day delivery of services in whichever setting that they are? The academics that are saying, oh, we have started now to incorporate palliative care basics within what we do and what we teach. We are actually moving into reviewing the curriculum so that it is actually integrated. So such evidences, therefore, they are very helpful. I don't know if Dr. Paul might want to add something that I might have missed in our experience.
If Paul has any additions, please feel free to jump in, Paul. But if not, I will move on to just reading Emma's comment. I was wondering about the willingness of donors to fund capital costs of buildings versus the ongoing costs of running programs and services. How do you convince, advocate for donors, to the donors of the need for the later when the building may be preferred as it might be seen as more tangible? That's a really good question. Can we pose this? I will just ask Angela last question, and then we will ask any of the two to answer this question. Angela, follow on the demonstrating impact based on your long experience with Life for African Mothers, but also as a nurse and now as a committee member of Global Health Partnerships Cymru. Talking about the impact for health professionals in both countries when you're applying for some or working on some specific projects and would like to have some personnel to support from the NHS, but also to have colleagues in local or in African countries or LMICs in general. How we can demonstrate impact and show that both countries are benefiting and not the countries, the recipient countries themselves.
Sure. Well, we've been a member of the Wales for Africa, as it was called when it was set up by Rodri Morgan in 2007. So they've been like I was called like a comfort blanket around us ever since then. It's been amazing. But as far as I'll use Sierra Leone as an example. We continued to do the training visits, and then of course Ebola struck, and then COVID struck. At the time of Ebola, there was no Zoom, so there was not much we could do. But now with COVID, what we did was we continued the training, but online, partly because it helped keep that interest and make them aware that we were not going to abandon them because of this the pandemic. But what we noticed, both with the visits and with the online, is that when you're speaking to a class of 20, 25 midwives, and it's the same here, wherever you're teaching, there's always a star that shines out, one or two stars that shine out from the class. So we had a chat, and we decided that we would sort of promote these midwives, and we call them champions. And they have been incredible. Honestly, their ingenuity and their ability to take things on is just remarkable. So we created midwifery champions, and the government then gave them time, protected time, to go out and teach their peers. The benefit of that obviously is that there's no cost involved, or very little cost, but also they're able to use the local dialect, which makes it easier for them to understand. So we had champions in every county of Sierra Leone. And so the group that went out in November, they met with the champions, make sure there were no outstanding issues that they needed clarification on, and then they had some teaching sessions with them, just updating, but in the main, they all went out and carried on doing brilliant work in the furthest flung areas of the country. And of course, like most countries, the wet season presents its challenges. But so we know that the impact on the midwives and the country and the mothers and the government has been enormous, because they kept asking us to go back and share again, and the impact on the morale of the midwives, knowing that they have this recognition. There was no additional pay, just a recognition that they are like champions in midwifery. Our people who went out, have gone out over the years, have learned a huge amount. I would defy anybody not to be changed, whether you're a clinician or otherwise. You come back a whole different person. I did the first time I went to Chad. You look at things differently. You appreciate everything around you, the NHS, your family, everything. And that's what the midwives found when they came back. They had a greater awareness of lots of different things that was not as great as it was before they went. And we've never had anybody say that they wouldn't go back. So we had a great relationship with Sierra Leone. Unfortunately, as I said, it's the main government. It hasn't been a problem, but the president was elected on a ticket of getting rid of corruption, and this is out in the press. One of the big drug barons from Europe has fled to Sierra Leone, and is being taken into the bosom of the president's family. And I think that really was the final straw, which is a shame, because the midwives out there love there's no questioning, why do you need to come? We know what we're doing. It was just like a big family. And I feel really sad that that's happened. But ultimately, we want the countries to take ownership of all of this. And, it's a great, hopefully, it'll continue to improve the numbers. I'll be watching the maternal mortality ratio and see if they go up or not. I don't know. We'll wait and see. But everybody who went, the clinicians are changed. They've been changed forever, and they will tell you that if they were any of them here now, they would tell you that they're different midwives coming back, and the midwives in Sierra Leone, Liberia are different. So I think that's probably the most I can say on it. It's indisputable, really.
Absolutely. And yeah, it's bi-directional, is both ways. And thank you for also highlighting the importance of in-country leadership, because it's important for sustainability in the long term. Thank you both. And now we are moving to the questions in the chat. I can see two questions now. The first one by Emma on the funding capital costs of building versus the ongoing costs of running programs and services. How do you convince donors of the need for the later when the building may be preferred, as it might be seen as more tangible? Would you like to go for this first, Angela?
Some grants will give you core funding, as we call it. At the moment, until we close completely, we have one desk that both of us share in the Temple of Peace, along with Dolan. And we keep our costs to the absolute minimum. The grant that we had for the medications and the midwives visit included some admin costs, so that's good. But we just do make it cost as little as I buy the paper for the printer and all sorts of things. So we keep it to an absolute minimum. But there are costs that you must have, you know, the insurances and the Wi-Fi and all the rest of it. So that's the sort of, and we're always upfront with the funders. People give us small donations that we do have some costs, but we keep them to a minimum. But in the main, we tell them that the medications are the first priority for us in getting them out to the country. The only person in the whole organisation who was paid was our country representative in Sierra Leone. And we gave some costs to the volunteers who helped out. But I don't know what the percentage is that it cost us, but it is a challenge, core costing. I don't know what the answer is for larger organizations. We were able to manage it as a small organization, but generally it must be a nightmare covering salaries, etc. Sorry, I can't be more enlightening than that, but
yeah, absolutely. Thank you, Angela. Tabelo, do you have any reflections on this from your experience?
From our experience, we have seen that it was really difficult to really engage the corporate community in terms of their ongoing sustainable financial support, even though they appreciated the need for our services. Hence, our efforts very early on to really ensure that we continue to improve our relationship with the Ministry of Health, really maintaining our stance about our vision, but also for them to appreciate our autonomy in as much as we wanted to have for the shared responsibilities into how to make our services sustainable. So we have been revisiting our memorandum of understanding in a case whereby we can now sit around the table with them to negotiate our financial needs in terms of the ongoing financial support for our running costs and all things like that, and salaries. So that is where we are as we speak. We are still yet to know their confirmation whether it has been possible for them to incorporate our budget into the upcoming budget, which is to be published next week on the 18th for the term starting from April onwards, because we knew the building can be there, but the services might not be possible if we don't have for their buying in. And them understanding it should have been them delivering this core service, because it's not an add-on or a privilege, but it's a human right and a part of the basic care that should be provided by each country to its citizens, not only prevention, not only treatment or promotion of health, not only the rehabilitation, but also palliative care, which has been lacking in this part of the world. But they now see that we tried to dress them up, bring the vision on, without really making them exposed to the public that they should have done it long time ago when the HIV rates were killing each member of the family week on week. Many of these African countries, that's when they started palliative and hospice care movements, because people were dying in enormous amounts, and nobody can still understand why Lesotho did not really pursue palliative and hospice care at that time, because as you might be aware, we are number one in terms of our ratio to our, what do you call it now, population, in terms of high numbers of HIV and AIDS. So that is to say, they should have been part of the leading countries in this journey. And within the 16 SADC member states, it is only Lesotho that did not have for palliative care efforts really nationwide. So we are only trying our small bit, and we believe pursuing the ministry, always engaging the political environments, the parliament, as we have been to the parliament with Ndadepol 2 years ago or 3 years ago, and meeting the prime minister as well is always helpful to meet those decision makers so they see their responsibility in what we do. Dr. Paul wants to add something.
Thank you, Tabelo. Yes, Paul, feel free to add your points.
Okay, thank you. Yeah, just to add to that, I think the question on basically ongoing costs and sustainability, which I see is in Menaka's question as well, and I think that is the problem. There's got to be a level of optimism and hope and risk taking, as I mentioned before. I think we look for continuing sponsorship. I think offering to use the sponsor's logo to give them publicity. We've managed to buy through generous donations a car which has already got logos on it, so there'll be some visibilities as that drives around. They haven't given it to us yet, I have to say, because they want extra publicity and a big event, which at the moment we certainly can't afford. Look at other activities. Something that we're all already started on is we've got a piece of land which we're farming on. So we're hoping not only will that supply food to our building, but actually we will be able to sell to supermarkets. There's a culture there of supermarkets buying off small farmers. So looking for alternatives of raising money. Talking about challenges and setbacks, and really just to talk about adaptability and resilience as being important, we have been made aware, Metabello mentioned about support from the government, and they have been very supportive in words, but not as yet deeds. So there is, we are hearing a strong possibility we will not get the money that we were expecting to pay for our staff, which is a body blow, or will be a body blow if that occurs. But we're already looking at how can we work alternatively. We're looking at our building, which was currently meant to be a day centre. It's much bigger than we expected, and we're now looking at repurposing the rooms to actually make them small wards, so we can perhaps have 9 or 10 beds. And then we're reviewing our principles, and a bit like the discussion that we had with Angela earlier on about, well, it's what happens to the money, maybe, that what counts most of all. We are now considering starting off having, if you like, private beds for our mini hospice, so that we can start working, we can start delivering, and hopefully we can make, I won't use the word profit, a surplus on that, because we're a non-profit organisation. We've always made that very clear. There's nothing in it for us unless we're actually working there. So with that surplus, provide a home service. The ethics for us are that's going to be providing a service to the wealthy, which isn't what we were anticipating doing. However, at the moment, there is no service in the country. Doesn't matter how wealthy you are. If you want palliative care, inpatient care, you need to go to Bloemfontein, which is 3 hours away, and think of the problems of the carers and travellers getting there, or Cape Town. So there won't be any doubt that the people that are getting our service will be people that need them, and they won't get any better services because they're paying. They might get a slightly fluffier pillow, who knows. But this being able to adapt and start looking about how can you raise money yourself and not be dependent on external, particularly out-of-country donors. And I think the other word that Angela mentioned was about ownership in the country where you're working, so that they feel it is their project and not a project from outside. There is a problem for us in Lesotho in that there isn't a culture of giving to strangers. People look after their families and their communities, but there isn't a culture of giving to strangers. So that's something that we need to work on. The corporates are beginning to demonstrate it. We have very little support from individuals, but we also hope to say, here's a cup of coffee. And yes, it could be you one day that will need our services. It could be your mother, it could be your sister, it could be your child that need your services. Again, pushing on the sort of humanities, pulling a little bit on the heartstrings. But it's going to be a challenge to keep on going. We don't know for certain how we're going to do it. That's a risk we're prepared to take, because if we don't take it, we'll do nothing.
Isra, could I add some more?
Absolutely. Yeah,
Okay.
absolutely. Go ahead.
There's a couple of things. One of them is I was asked to go to Ghana by a potential funder about 10 years ago. And while we were there, we met with the Ministry of Health. And at that very time, there was an announcement on the internet that the EU were giving Ghana 50 million euros specifically to reduce maternal mortality. Nothing else, just that. So we hightailed it back to the ministry and said, is this right? And the minister said yes. I said, well, we can help you with that. We've got access to medicines, midwives, equipment. We can do all of that. So they were full of enthusiasm for that and said we'll be in touch, an MOU, etc. We traveled back to the UK, and I then was emailing and getting very little in return in communication. And ultimately, the communication went to nothing. So it continued on that I was getting requests from the diaspora, the Ghanaian diaspora, to see if we could help. And some of them even came down to Cardiff. By the way, that's not where I live behind me. There's a lot of water around, but not like that at the moment. There's flooding everywhere. But anyway, so they came and I said, look, this money has been given by the EU. What changes have there been? And I don't know if there are any Ghanaians in the audience here, but the only thing that they could see was that Ridge Hospital in Accra had a makeover. So I eventually wrote to our patron, Baroness Kinnock, and as you know, she's since died, to say, with your contact in the EU, can you find out where this 50-odd million euros went? So she said, well, I'll try. And so it took about 6 weeks for her to get the reply for me, but she did. And there's a table of how it was all. 49 million euros went to the Ministry of Finance, and all the rest was shared out, such as it was, amongst some small NGOs, nothing significant. So whether this Ridge Hospital had a makeover like you wouldn't believe, the money disappeared. And but the sad part was that what my contacts were telling me, that the standard of care in the hospital, women were still dying who shouldn't have been dying. Nothing had improved. And so that's another challenge you've got. You know, the EU are giving money. Why aren't they following it up to see whether it's being used appropriately? Why aren't they monitoring anything? There was nothing, no follow-up at all to say this is how the European Union money had been spent. It was disheartening, really, because we could have done so much with midwives lining up. So this is a really big challenge. And when you look at the map of Africa, as I've been seeing on LinkedIn a lot lately, about the productivity, the GDP of the countries in Africa. South Africa leads Nigeria, and a lot of these countries have got horrendous numbers of women dying. So what's going on? And I think there are times when we have to bite the bullet, and if we have the opportunity to challenge these people, if we're in their company, why is it that this is the situation? Then we should do it, because by not doing that, we're not helping the situation. And I was in Somaliland, and I asked an audience of men and women, did they know that it was the father of a baby who determines whether it's a boy or a girl? And it was like complete silence, and the men looked very uncomfortable. So I looked at the men, and who were all sat together, and I said, do you realize it is you who determine whether a baby is a boy or a girl? And these are academics, business people. They shook their heads. So I explained in graphic detail how a baby becomes a boy or a girl. And I've never seen a number of people so uncomfortable in my life. They were sweating in a well-air conditioned room. And I said, do you believe me? And they said, yeah. So I said, so why are women set aside when they don't produce boys, when it's actually down to the father? So I know it's difficult. And when I got back, the midwives, the Somali women here said, you can't talk about things like that. I said, well, it's too late. I've done it. And unless somebody tells them, they'll never know, or they'll pretend not to know. So sometimes an uncomfortable truth is something that we have to say, as long as obviously it doesn't put you in any danger. But, you know, at my age, and I can say what I like and get away with it, really. But it's very challenging. And just on a personal note, my father's mother died in childbirth in 1915. And we found out 10 years ago that she died of postpartum hemorrhage, which is the very thing that's killing 100,000 women every year still worldwide. It's just a disgrace, really. And often it's the government and political will that is causing this problem, is the lack of, and the status of women, of course. So sorry I've gone on a bit, but you know, we have to share these experiences because people will learn, hopefully.
Absolutely.
From them.
Yeah, absolutely. It's a learning event. Thank you, Angela. We are short of time. I can see one last question, Manaka, but Paul has kindly answered most of it regarding the how can you maintain your persuasiveness and credibility, and how can you sustain it in the long term. I'll just see if Tabilo has anything she would like to mention, maybe in a couple of, maybe in a minute or so. Or Angela, if you have any addition to what has already been mentioned by Paul regarding the sustainability of your credibility and persuasiveness.
I do have one thing, but if Tabile, if you want to go.
Yeah, you can go ahead, Angela.
Okay. All I was going to say is when I present and people say to me, why are you worried about this? This is Africa. We've got enough problems in this country. And I say to them, if you turn this whole thing on its head and imagine you live in a country that's war-torn, etc. And somebody says to you, if you get to this country, they will look after you. You know, you're not in danger. There's no bombs flying. You're going to try and do it, aren't you? And you know, people cross the Sahara Desert, they cross the Mediterranean, they cross Europe to come here. If we can help to stabilize these countries and enrich them, they will stay. And people, I say, why do you leave? Well, it's so awful here. So if it was better, would you stay? Yes, of course. So this isn't about an expenditure that's unnecessary. This is an investment in trying to help stabilize countries and keep people where they should be and where they want to be, rather than being forced out. And there's no coincidence that the countries with the highest rates of maternal mortality tend to be the poorest. So the two are inextricably linked. So that was what our rationale, really, in trying to make a difference.
Fabulous. Thank you. Thank you so much to to Angela and Tabelo, to Paul for brilliant talks today. And thank you to everyone for joining us and for your engagement throughout the session. We're coming to the end of this shared learning event. But I will now hand over to Simeon, who will talk us through some resources that Hub Cymru Africa has kindly prepared for people who would like to continue learning and continue knowing about opportunities coming up. Thank you.
Yeah, thank you, Isra, for that wonderful coordination. Thank you all joining us today for your active participation. And a big thank you to our two speakers for sharing their expertise and financial practical experiences. The poll has been shared on the screen. Please, you can kindly fill it. And this help us to have the feedback of this event for us to do it better. And we hope that you find this section useful. And we want to remind you that there are a lot of resources and support available to help with fundraising and health projects. And on Hub Cymru African website, there's a search for funding opportunities that you can see. And also on Global Health Partnership website, you can see fundraising guides and also diverse resources on online fundraising tips, strategy for tip sheets, webinars on fundraising, and also finding your match fundraising research tools are also on Hub Cymru Africa websites. And also there is one-to-one support that Hub Cymru Africa do give. You can email us anytime at advice@hubcymruafrica.wales. And we also appreciate your feedback on today's section. And the poll has been shared already, and we'll be grateful if you could take a minute to complete it. And as your input help us to improve on our future event. And please don't forget that we have upcoming events. You can look into our website. We have context-specific products and sustainable funding models. This online program that is coming up Wednesday, 25th of February by 12 o'clock. And also we have International Women's Days for celebration. This one is an in-person event at Temple of Peace on Wednesday, 11th March by 7 p.m. in the night at Temple of Peace, Cardiff. Please, we are endeavor for you to join also. Also, we have Safeguarding Essential Training, is an online training on Tuesday, 17 March by 12 to 4 p.m. It's essential for you to also to join. Also, we have Safeguarding for Trustee and Focal Person. This also is online program. This is holding on Thursday, 16 April by 12 o'clock. And also, there's a UK Global Health Summit 2026 organized by Global Health Partnership and Shaping Tomorrow's Health Together. This is taken up between 16 to 18 March. You can go to the Global Health Partnership website and sign for that program. Thank you once again for attending, for engaging with this discussion, and for your commitment to fundraising for health in challenging time like this. What ring bell in my memory is partnership, collaboration, and joint grant bidding are smart and strategic responses to aid costs. And we hope to see you at our next event. Thank you for your participation. God bless.
Thank you, everyone. Bye.
Thank you. Bye.